Miscarriage in early pregnancy. Miscarriage in early pregnancy. Why does it happen? What are the causes? What are the signs of a miscarriage? In this video today, we are going to talk about a miscarriage in early pregnancy. Mu video yaffe ya leero tugenda kwogera ku biki ebituukawo olubuto okuba nga luvaamu nga lubadde lukyali luto. We are talking about a miscarriage in early pregnancy. After this short break, we are coming back. Hello my friend, welcome to our channel, Gerald Massa, the Health Educator. On this channel, we do create awareness about fertility and reproductive health. Have you been asking yourself, what are ovarian cysts? What is endometritis? How can you get pregnant faster? How can you calculate your ovulation days? How can you tell that these are your danger days, these are your safe days? On this channel, Gerald Massa, the Health Educator, we do talk about all this. We answer all your questions and we actually give you free consultation. Let me know if you have any questions. Welcome for today's lesson, and if you are ready for today's lesson, I'm ready, and let the lesson begin. Moving on, we are talking about a miscarriage. A miscarriage is a loss of a pregnancy before 20 weeks of gestation. When a woman is pregnant and before she makes 20 weeks of gestation, or before the pregnancy reaches 20 weeks, the pregnancy all of a sudden it comes out, we call this a miscarriage. We are talking about all this. What are the causes of a miscarriage? First of all, before we look at the causes of a miscarriage, we shall first of all understand that when a male sperm, which is containing 23 chromosomes, combines or fuses or even joins with a female egg, which also contains 23 chromosomes, we end up with an embryo. We end up with a fertilized egg, which is known as a zygote. It grows on to form what we call a blastocyst. In simple terms, when a man sleeps with a woman and then fertilization takes place, there's going to be formation of a fertilized egg. A man or a male sperm contributes 23 chromosomes. A female egg contributes 23 chromosomes. When we get 23 chromosomes from the man and then 23 chromosomes from the female, we get what we call 46 chromosomes. Now, what are chromosomes? You may be asking yourself, we are talking about, Gerald is talking about chromosomes. What are the chromosomes? Chromosomes, specifically, we shall call them as, let's take an example of shelves. If at all you have, let's say, a shelf, or you have a carrier, and then inside that carrier, there's something that is being that is contained in that carrier. We assume that that carrier, that big carrier, is what we call the chromosomes. What it contains is the genetic material, or it contains what we call the genes. So the chromosomes are the carriers of the genetic hereditary material. The genes, or the genetic material we are talking about here, specifically determines, it's that component which determines how your hair is going to look like. It determines how your eyes are going to look like, your eye color, your skin color, and then all that. What is contained, or what determines that when a child is born and is growing up, is what we call the genes. What carries those genes are what we call the chromosomes. So a male sperm contributes 23 chromosomes. A female egg contributes 23 chromosomes. Ideally, this is how it's supposed to be. But if at all we have what we call chromosomal anomalies or chromosomal abnormalities, remember we said that the male sperm is supposed to carry 23 chromosomes, but you end up with a male sperm which is carrying less than what is expected. It's carrying 20 chromosomes, or it's even carrying 24, 25 chromosomes. Then there's going to be an anomaly, there's going to be an abnormality. This answers our first question. What are the causes of a miscarriage? The first cause is what we've just talked about, chromosomal abnormalities. Chromosomal abnormalities. When a male sperm is fusing with a female egg, when they are joining at fertilization, and then maybe something happens along the way, and the male sperm does not carry what is expected, does not carry the specific amount of the 23 chromosomes, then we are going to end up with a miscarriage. In some women, actually, the pregnancy may proceed, it may go up to term, but what happens is that there are high chances of a child being born with abnormalities, what we call congenital abnormalities, including issues like Down syndrome. So the first cause of a miscarriage is chromosomal abnormalities, and we have talked about all this. Remember, if you have any questions, you can always ask me down below in the comments and I will answer all your questions. Tuli kwogera ku biki ebiviirako olubuto okuvaamu. Tugambye nti ekisooka ekiviirako olubuto okuvaamu kye tuyita chromosomal abnormalities. Chromosomal abnormalities bwebwo obuntu oba obusirikale obutambuza enkwaso ezigenda okubanga kwegamba zifuula omuntu okubanga either muzungu oba mufirika, era n'olaba nti obukwaso oba obuntu obwo obusirikale obwo kasita bubanga tebumala, kyangu nnyo olubuto okubanga lufuna kye tuyita miscarriage oba okuvaamu. So when a woman has just had a miscarriage, tests should be done to confirm what could have caused this. But before we go to the tests, we are still talking about the causes of a miscarriage. The second cause of a miscarriage is infections. When we talk about infections, many times you have gone to hospital and your doctor has done some tests, has done a urine analysis test, and then the doctor has told you that you have an infection. But you go ahead and ask, what type of infection do I have? Then, of course, your doctor is supposed to explain this to you. But in this video, we shall be very precise and straight to the point. When you are a woman and you have issues in your reproductive system, for example, if you have endometritis, this is presence of free fluid inside your womb, inside your uterus. When there's this free fluid, which is a result of poorly treated infections, poorly treated UTIs, then ideally this is going to cause issues. Why is it going to cause issues? Let's say you have got, you have been with your partner today and then fertilization has taken place. Now this egg is going to roll and actually divide and form what we call a blastocyst. A blastocyst is among the earliest forms of life. A fertilized egg will form what we call a blastocyst, kind of like a small ball, which will roll along your fallopian tubes, and then it will go and attach itself on your uterine wall or on the wall of your uterus. Now, remember, before the pregnancy, you were having infections. You were having issues with your womb. It's not clean. It's full of infection. It's full of conditions like endometritis. What is going to happen is that as the egg, which is fertilized, tries to attach itself onto the wall of your uterus, just because there's already issues inside, the egg will fail to implant, and there are high chances that you may be actually standing or you may be in the shower, taking a shower, and then a clot or a drop of blood or a big clot of blood comes out and it drops. Normally, that is a miscarriage. But of course, you have to go ahead and see your doctor, who will do more tests on you to confirm whether you've just had a miscarriage or not. So, next cause of a miscarriage is infections. Remember, we've said that the first cause is chromosomal abnormalities, the second is infections, and we have said that infections like a pelvic inflammatory disease, also known as a PID, endometritis, or even cervicitis, your cervix having issues, is going to actually predispose you to having what we call a miscarriage or a very early pregnancy loss. Tugambye nti ekyokubiri ekiviirako omukyala okubanga avaamu olubuto kye tuyita infections, obanga obadde olina infections ezibadde nga zikuluddeko akabanga era kyangu nnyo okubanga zireetera olubuto okuvaamu. Gerald Massa, the health educator, is the name of the channel. If it's your first time on this channel we do create awareness about fertility and reproductive health. If you have any questions, connect with me here, ask your questions in the comments. If you would like to talk to me privately, talk to me on my WhatsApp number. It's all over. It's on the screen. +256 701 7978 76. We shall talk more about your questions, about your fertility issues, and we shall get solutions. On this channel, we get solutions for your fertility problem. Next cause of miscarriage in early pregnancy is what we call improper implantation of the fertilized egg onto the uterine wall. Now, when a fertilized egg is attaching itself onto the uterine wall or onto the wall of your uterus, and then instead of attaching itself strongly, it maybe attaches itself in the corner next to the fallopian tubes, or it attaches itself at the cervix or the opening of your womb, then there are high chances that as you are walking around carrying heavy things, doing lots of work, because of the improper implantation, improper attachment of the fertilized egg, then there are high chances that the pregnancy could end up into a miscarriage. How do you confirm that the implantation of your baby or the attachment of your baby onto the wall is normal? You simply have to do what we call a pelvic ultrasound scan. You do a pelvic ultrasound scan and your doctor will confirm to you whether the attachment or the implantation is normal or it's abnormal. Next cause of miscarriage in early pregnancy is maternal age. It's known that as a woman is aging, as a woman is growing, there are many changes that take place. These could be hormonal changes. So as a woman is approaching her early 40s, early 45s, there's high chances that even though she has got pregnant, the pregnancy may have issues. But please do not take this that every woman who is in her 40s or every woman who is making 45 is going to have a miscarriage. No. We've worked on several women who are 45, they are pregnant, and they've gone ahead and had successful pregnancies. But there's a percentage of women who will have hormonal issues. So if you are in your 40s, you are 45, and you are pregnant, please do not worry. Do not say that your pregnancy is going to end up into a miscarriage. No, your pregnancy is going to go to term. But there's a percentage of women who may be approaching that age group, but they could be having hormonal issues. Still, you have to talk to your doctor to make some assessments on you, to check or to take a look at your hormones. The hormones we are looking at specifically here is what we call progesterone. If your doctor does a serum progesterone level test on you, or if your doctor checks the hormonal level of progesterone and the results show that it's within the normal ranges, even if you're 45 years, even if you're 48 years and you are pregnant, there are high chances that the pregnancy will go to term. But if the tests show that you have very low progesterone levels in your blood, then still we do not have to sit and wait for the miscarriage to happen. Your doctor will put you on supplements of progesterone, or your doctor will put you on treatment of progesterone. This is available in form of pessaries, which you can insert down in your private parts, or even in form of tablets, or even in form of injections. So still, when you are a woman and you are in that age group and that is very, very predisposed to having miscarriages, still your doctor can address this issue. Next cause of a miscarriage in early pregnancy is uterine abnormalities. When we are talking about uterine abnormalities, specifically we take a look of the uterus, and the uterus is having three layers of tissue. We have the outer layer known as the perimetrium, and then we have the myometrium, which is the middle layer, which is always thickened, or which is that big muscular layer, known as the myometrium. And then we have the innermost layer, known as the endometrium. Now, the endometrium is where the baby attaches. If where the baby is going to attach, there's already a mass, there's a fibroid, or there are issues in your womb, and then the pregnancy is going to take place, what is going to happen is that the pregnancy will fail to attach very well. Still, it goes down to improper implantation. But uterine abnormalities can also cause issues, and they can predispose a woman to having miscarriages. Next cause of miscarriages in early pregnancy is lifestyle factors. When we talk about lifestyle factors, we are talking about women who do smoke a lot, women who they drink alcohol a lot. When a woman is an alcoholic and she's pregnant, there are those women, there's a percentage of women who will carry the pregnancy up to term and they will give birth to normal babies. But there's a percentage of women who are drug addicts and who are addicted to alcohol, who may actually be predisposed to, or who may have increased chances of having a miscarriage. So ovulation is the release of a mature egg known as a Graafian follicle on the 14th day of your menstrual cycle. This egg goes on and it gets fertilized. When it is fertilized, this very egg goes on and grows into a baby. Now, when this egg attaches itself onto your uterine wall or your womb, we call this an intrauterine pregnancy. If this fertilized egg remains in your tubes or your fallopian tubes, then it becomes what we call an ectopic pregnancy. If this egg is attached onto your uterine wall, it grows into a pregnancy. There will be a gestational sac or the sac of the baby, but if the embryo fails to go into the sac, then we call this a blighted ovum. Do you have any questions about fertility? Would you like to know about pregnancy, how you can get pregnant faster? Have you been asking yourself, why are you feeling that abdominal pain? Then you are in the right place. On this channel, we do create awareness about fertility and reproductive health. Gerald, Massa, the health educator, are my names, are the names of the channel, and I welcome you for this lesson today. Remember to ask me all your questions down below in the comments, and I will answer all your questions definitely very fast. Thank you for watching today's video. I hope you have learned something in today's video lesson. If you have any question about fertility, about reproductive health, or about how you can get pregnant faster naturally, then just go down the comment section of this video and ask your question. I will answer all your questions. Nsanyusa nnyo mukwano gwange okubanga obadde naffe leero. Oba olina ekibuuzo kyonna kyonna ekikwatagana ku video gy'olabye leero, oba oyagala okubanga nkuddamu, beera nga ombuuza ebibuuzo byo mu comments eza video eno, nja kuba nkuddamu. Remember to subscribe so that you do not miss new videos we release every day. And then also remember to hit the like button so that we reach more people here on YouTube. Have yourself a fantastic and healthy day, and remember to donate to support our work. May God bless and protect us all. Bye-bye.